Hello and welcome to my video blog number 5 about the chemo treatment number 4. So, how I've been feeling since the last chemo, a lot of tiredness, back pain, off and on, but not so much tummy pain, some headache, and that's about it for what I could think right now. However, yesterday I went for a massage. I asked my doctor last week if it was okay for me to get a massage from my back because it was so much painful, and he said yes, that's not a problem. And he also told me that I could use heating pad. That was not a problem as long as it's not too hot, but a warm temperature, it's fine. So I went for a back massage yesterday for an hour, and I have to say it helped me a lot. It made a difference for quite a few hours. In fact, today my back is not as painful right now. It's more in the shoulder this morning when I woke up, and but for what I'm seeing, it's starting gradually to come back. So, but it gave me at least quite a few hours of relief, so which was great and helpful. For as far as the bleeding, for the past 2 days, the bleeding has dropped drastically. In fact, now it's more spotting than bleeding as of right now for the past 2 days, and I still have some blood clot. The tiredness is as strong as before. I mean, it doesn't go better right now. It doesn't seem to go worse either. It seems like I'm in this standstill, tired all the time, and it probably because I'm home resting too, that helps. Like I said, every time I do a chore or something for about 10 minutes to an hour maximum, it trains me even worse, and it gives me pain worse. So I try to rest as much as possible and do little as possible. As far as today for the chemotherapy that I received, the pain and the burning lasted for about 20 minutes this time. I'm not sure why it was longer. Like I said before, maybe it's just the nurse that's giving it to me, although it was the same one as last week, and today somehow it just so happened that it lasted a little longer. I had my chemo about 25 to 30 minutes ago, so my nausea started. I took a pill immediately, and the tiredness, obviously right now I'm tired the way I'm at all day long, but the tiredness of the chemo is gonna hit me. It's starting to hit me slowly, so but it'll definitely will in a couple minutes. It takes about 30 minutes to 45 minutes maximum to really hit hard. This morning I had a huge headache, so I don't know if it will turn as a migraine, but that's how it happened before when I had a headache. And the nurse today told me to don't be afraid to take what I would usually take for migraine, to just try to release it. And I think that's about it. Also, for since yesterday and today, I've been smelling something. It's kind of weird. I'm not sure if how normal this is or if it's a side effect or what. Next week I'm seeing the doctor, so if I see that doesn't come back to normal, I'll ask about it. But the smell that I'm smelling, it's been, the cream that you put when you hurt yourself and it's open bleeding, that kind of cream that you put there, that's what I'm kind of smelling all the time. Or should I say most of the time during the day, even when I'm eating. So it's kind of annoying. But yeah, as far as the itching and burning feeling that I had at first in my head, I really haven't been having that since then. I still didn't ask the doctor. Obviously, I had bigger concern with my back pain the last time that I saw him, but it doesn't seem to happen, or rarely, so I'm not really concerned. Plus, when he spoke to me about the cancer and the chemo treatment that I was going through, I asked him, that was one of my first questions, would I lose my hair? And he said it would be unlikely because, you know, my numbers are so low. They're low, so it doesn't have to be as strong as a chemo treatment that if it was in the 10,000. So that's why I'm more or less concerned about it, and it's not, the feeling's not there as much. So that's about it for today. I guess I will speak to you next week. Hopefully, if you're going through that, uh, your numbers are going lower as well. Me today, my numbers was at 38, which is great. My body still responds very well to the treatment, which is a great news. So according to the nurse, I'm seeing the doctor next week again, but according to the nurse, I will need about 2 or 3 more treatment. So it's until it's at 0. So if next week it's at 0 or -5, that's perfect. That means I need 2 more treatment. But if it's above 0, so let's say at 5 or 6, whatever, then I would need an extra treatment. I would need 3 more treatments. So depending of the numbers, obviously. So we're heading the right direction. We're fighting this cancer, and we're gonna get through it. So I will speak to you next week, and hope you all the best once again. All right, take good care.